friends, it's Lee again. Today I have a video for you about mental health. It's a topic that's very important to me, and I like talking about things like this out in the open to normalize the conversation and hopefully help people feel less alone if they're in a similar state or situation. And as the title says, today I'm going to be talking about why I'm switching my psychiatrist. And there's a couple of reasons, but first I wanted to give a little backstory. When I was about 14, I became extremely depressed. For about a year, my family was urging me to get help and maybe get on some sort of medicine, but I refused because I thought that that made me weak, and that was my main reason for not doing it. I knew, or I thought it would probably help, but I didn't want to show that weakness in my personality to where I needed something like that. About a year passed, and when I was 15, I was suicidal for the first time, and that just completely freaked me out, basically, to where I started seeing a doctor. And at first I was diagnosed with clinical depression, but after my doctor saw me for a few months and saw the cycling of highs and lows, she went ahead and changed my diagnosis to Bipolar 2. And if you don't know what Bipolar 2 is, it's like Bipolar 1, where there's extreme highs and lows in personality, but it's less extreme than in Bipolar 1. In Bipolar 2, the highs, the mania, is more subtle, and the lows are usually longer and might be more frequent than someone who has Bipolar 1. Beyond that, that was my only diagnosis until I started college, and then I was diagnosed with ADD, or attention deficit disorder. It's kind of strange to be diagnosed with that so late in life, but as my doctor put it, if someone's, I feel weird saying this, but she said if someone's above average intelligence, then sometimes the symptoms don't show up until they graduate to the level of difficulty of academics that college gives you. She said something about basically that means you can kind of coast by throughout grade school and high school without needing medication. So I've been seeing my doctor for over half my life, and of course I'm very thankful to her for all her hard work and keeping me stable for over 15 years. There were of course ups and downs, and it's kind of a guessing game when it comes to which medications are going to work and which ones need to be a higher or lower dosage and things like that. So it's a difficult job, and she did her job well. But a couple things have come up recently that gave me the idea that it was time to switch things up and move on to someone who could maybe suit me better. And the first thing that happened that gave me this idea was that I came in one day really excited for our little checkup that we have a few times a year, and I was excitedly telling her about EMDR therapy, eye movement desensitization and reprocessing. And I guess I'll link below to what that entails, but I was excited about this because I thought it might be a good option for me. And the second that I said EMDR, like I was barely done saying the letters, and it was immediately like shaking her head and like, oh, no, 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 no. Okay, sorry if the lighting is different. Someone came over and I wasn't expecting them yet. Anyway, I was telling my doctor about EMDR therapy, and she was immediately just didn't even consider it for like half a second. She was saying stuff like, that's only for severe post-traumatic stress disorder, like if you've been sexually assaulted or you're a war veteran and stuff like that. And the truth is, trauma can look different for everyone, and those extreme situations are the most common usage for EMDR. But I've seen a little bit about it can sometimes be for anxiety, it can sometimes be for phobias and all this different stuff. And the fact that she was just so dismissive just made me think that she was like more closed-minded than I thought she was. And it just really put me off, that especially because I feel like as a doctor, as someone who's known me for such a long time, I never come in to her office with this kind of like news. Like, it was news to me, it was exciting, and I feel like that in and of itself should have made her like consider it at least a little. But she just she basically said it wasn't for me, like my situation wasn't extreme enough to warrant that kind of therapy. And it was just completely like invalidating. It like confirmed my false belief that my situation's not that bad and I'm kind of being a baby about it and all this stuff. So it was just extremely off-putting. And so that was kind of like the first strike. And I guess she kind of only has 2 strikes, but still. The second one, it's an extremely long, convoluted story, but basically she prescribed me a medication. She doubled a dose of one of my meds because I was having more anxiety than I was used to having. So she picked this one medicine and she doubled the dose from 20 to 40 milligrams. And she tried to do this one other time with, I can't remember now if it's Bupropion or Prozac. Yeah, so it was fluoxetine, which is Prozac. I usually take 20 milligrams. She upped it to 40. And I called over there multiple times to the office, and they had my chart out and everything. And I was just trying to figure out, is this the medicine that when it was doubled a couple of years ago, it made me cycle really intensely, like multiple times, up and down in like 24 hours, and extreme lows, like I dissociated, I wanted to cut, which is, I mean, I've self-harmed before, but like the specific cutting thing like threw me off because that was a first for me, that it was that specific kind of thing. But not to dwell on it, but it made me feel really crazy when I was on this medicine that was doubled. And I kept calling over there to see if this is the one. Like, I was asking them to look back in my chart, and I think it was like January or February of 2017. So I pointed them in that direction, and they had my chart right there. And for some reason, they couldn't just look right before that, like what my meds were, and then right after that, what my meds were, to see if this was the medicine that made me freak out. Like, I don't understand why they couldn't just say, I don't know. Like, basically, I had to come to the conclusion by myself through trying to jog my memory, because I remember whatever medicine it was something I already took, and it was doubled. So she doubled fluoxetine again, and I didn't take it at all. Yeah, their office is known for like miscommunication and stuff like that. And if you call in a medication, like sometimes you have to call a second time just to make sure it gets done. And all these things that were making me feel like I deserve better. Like, I deserve better care. Just because you've been with someone for a really long time doesn't mean that you're stuck with them. So that I got sidetracked, but I actually got on the phone with my doctor and said, I had to say it, and I was just like, I'm pretty sure, but it was still slightly a guess because they couldn't figure it out in my chart. Because my chart said, obviously when I went into my doctor, the chart said rapid cycling, self-harm thoughts, and all that stuff that I was describing to her. So I never got a straight answer, and I basically said, I'm pretty sure this was the one that made me cycle really fast. And so my doctor said, oh, okay, no, okay, well, we won't do that. And then I forgot the detail right now, but she told me to take, I think, 1.5 of another medicine that I take, Wellbutrin. She told me to do that, and I think it's important in healthcare situations, in life situations, to follow your gut. I feel like a lot of times our intuition is correct, and maybe we're taught as a society or as adults that it's just a feeling, but a lot of times feelings are pointing you in the right direction. At least that's how I feel, because there was something in her tone when she said, oh, okay, well, just take 1.5 of your Wellbutrin. She said it in such a like offhanded, flippant way. She was like, okay, just do that. Yeah, just do that. And it felt so weird. It felt like she didn't care, like I was bothering her and all this stuff. So I don't know. And the real kicker is I looked up, I'm not sure. I don't want to start over again. I've been starting and stopping so many times in this video, but I'm not sure if it was Wellbutrin, but whatever the medicine was, I looked up, and it wasn't this like archaeological Google search within Google search of like what exactly is the chemical component of this medication or anything like that. But upon like a moderate Google search, it said that this medicine that she like offhandedly told me to take more of, it's not ever for anxiety. It's for other things. And there's a thing called off-label uses, basically, where it's what it sounds like it's not the official on paper like disorders or symptoms that this medicine is specifically made for. It's kind of like additional things that happen to, like additional things that the medicine is good for. Like studies have shown, patients have shown that it's also good for XYZ. And I hope I'm not saying that the wrong way. But basically with this Wellbutrin or whatever it was, I'll put down below which one it was, if it was Wellbutrin or not, but I couldn't find anywhere that said it was ever for anxiety, and that's what it was supposed to be treating. And it said that even the off-label usages don't include anxiety. So that was just, I never took it. I never took the extra Wellbutrin. I never told her that. My plan is to find a new person. I got a recommendation from a coworker. I'm looking to switch within this month, before my next appointment with my old doctor. That's in, I think, early-ish January. So yeah, I think that's about it. I hope this video was interesting or maybe useful to you if you're seeing a doctor, even if it's not a psychiatric doctor, if it's your OBGYN or your dentist or whoever, and you just have this feeling through your gut feeling, but also through these little cues that your doctor's giving you that it's just not a right fit, it's not a partnership that's going to benefit you, then hopefully you can look into your options. I know it's difficult with insurance and things like that, like, or lack of insurance, whether you can afford to change doctors or if a doctor that you know is better isn't under certain insurance and stuff like that. But it's so important to be your own advocate in when you see any health professional. And just know that if you're dealing with anxiety or depression or anything like that, you're definitely not alone. And I recommend, it's a small thing, but there's a few Instagram accounts that I feel like are a good line of positivity. And I'll go ahead and link those below too. Not saying that that's gonna like make you feel, 100% better, but I feel like with social media and stuff, what you feed yourself in your brain and your eyes can affect your mood. So yeah, that's about it. I hope this video, maybe struck a chord with you. I'm pretty sure my next video is going to be Harry Potter related. I'm not 100% sure, but I'm mostly sure. Anyway, please like, comment, subscribe, share. Let me know down below if you've had an experience like this. And I guess that's about it. I guess that's about it. I'll see you guys next time. Thank you for watching. Bye.